COVID rapid tests used to be easy to find and often free. Now even pharmacists have trouble tracking them down.
I have some boxes left actually because I found the supplier.
When he stopped getting free tests from the province, he had to turn customers away.
Prior to finding this supply, we were just telling people that we don't have and to look in other pharmacies.
These are the big ones.
This pharmacist has secured a coveted stash from a private company. But he expects he'll sell them all by the end of the day.
We keep increasing the supply that we order, but they're still all going.
Health Canada stopped handing out free tests to provinces and territories in May. It tells CBC News there are no plans to replenish the federal inventory after it is depleted, even as temperatures begin to dip and respiratory viruses start to make the rounds.
If you look at the top 5 respiratory viruses that are circulating, it's SARS-CoV-2, SARS-CoV-2, SARS-CoV-2.
The latest numbers from Health Canada suggest COVID-19 levels are holding steady, but this infectious disease specialist thinks it's an underestimate.
If you don't have rapid tests, you don't diagnose. If you don't diagnose, you don't go seek treatments, especially if you need it, and we also don't get diseases under control.
Experts say it's the most vulnerable who pay the price.
Without that positive test, older adults may not get that treatment that they need to keep them out of hospital.
If you have expired tests, experts say most work for a few months after the expiry date. But false negatives are a risk. If you can't find new tests at your local pharmacies, your province may have special clinics with rapid tests. And if you're at higher risk of severe illness from COVID-19, you may qualify for PCR testing in some provinces. And more tests may be on the way. One major Canadian manufacturer tells us it's increased COVID test production in the past few months, and it expects to ramp it up even more for the winter. Jennifer Yoon, CBC News, Montreal.